Hi, my name is Kaylee Gray, and this is my final presentation for Biology 1030, Pathophysiology. These are my notes. Today I'd like to talk to you about Lyme disease. Lyme disease, which is also known as borreliosis or Lyme borreliosis, is a vector-borne disease that's caused by bacteria in the Borrelia genus and is spread by ticks in the Ixodes genus. So the Borrelia bacteria is spread via tick bite. Now it is important to note that the tick must be attached to you for 36 hours in order to transmit the Borrelia bacteria to cause the infection. Here in the United States, it's usually from Borrelia burgdorferi. That's the most common infection type. However, in Europe, there are several other bacteria in the Borrelia genus that may cause a Lyme disease infection. Lyme disease has several different stages. There's an acute infection stage. If treated right away, usually there's a good prognosis for long term. However, if not treated right away or if not while responding to treatment, it may continue further into a chronic disease state. We call that post-treatment Lyme disease syndrome. And also in terms of syndromes that this disease might fall into, it affects several body systems, and so there's quite a few different syndromes it might fall into depending on how the symptomology of that specific patient is and how the long-term disease is progressing. So, as I said, Lyme disease may affect several body symptoms, and there are several stages of it. So in the early localized infection stage, where this is where you really want to catch it and treat it. This is how you're going to get the best long-term prognosis. One of the most common early signs is a rash, an early localized rash that is known as erythema migrans. Usually it is a red rash. It may have a bullseye shape to it at the site where the tick bit the patient. Usually the patient may not know that they have been bit by a tick or may not know that one have been attached. Again, the tick must be attached for at least 36 hours in order to pass on the bacteria. The bullseye rash usually appears 3 to 32 days after the initial bite. It may be warm and itchy, although they're usually not described as painful. They may come along with some the other signs and symptoms from other viral-like illnesses. So the patient may be reporting fatigue, headaches, fever and chills, things of that general sort. Usually this, when we're in the early localized infection stage, we treat with antibiotics. There's a number of different antibiotics that are effective, and then it's caught early and treated early. Usually the patient has a good long-term prognosis. The next stage is the early disseminated infection stage. This is when the localized infection continues on without being treated. It may spread through the lymphatic system, and in this case, when it does spread through the lymphatic system, the patient may be reporting muscle and joint pain or generalized fatigue. If it spreads and disseminates into the nervous system, the patient will develop a condition that we call neuroborreliosis. This is similar to like the presentation of a viral meningitis. Patient may present with facial palsy, with stiffness, with generalized weakness. They may also report a stiff neck and vision loss that are both very common in viral meningitis as well. The patient may also be experiencing Lyme radiculopathy, where they might be complaining of spinal pain, nerve pain, some generalized weakness and numbness in the extremities, altered sensation, maybe the report that stimuli in one area of the body, they're getting sensation in a significantly different portion of the body. And then the patient may also be going through some Lyme carditis, which is similar to other endocarditis symptoms. They may have palpitations, they may be reporting shortness of breath, chest pain, dizziness, things like this. Once we get past the early infection stage and the early disseminated infection stage, the patient then, depending on the treatment and when they were able to actually get treatment, they may progress into the late disseminated infection stage. Aside from the Lyme radiculopathy and the Lyme carditis, they may also be experiencing some Lyme arthritis, This is especially when the Lyme disease has spread into the lymphatic system and is spreading throughout the body. They may be reporting stiffness, joint stiffness and pain, peripheral neuropathy, more altered sensation. Patients may also be undergoing Lyme encephalopathy as it continues to spread through the nervous system. They may be having cognitive difficulties, insomnia, general senses of feeling unwell, sleeplessness, early agitation, things like that. If the Lyme disease is treated early, again, you've got some good long-term prognosis. However, if it's not treated and caught right away, if it is allowed to disseminate into the nervous system, into the lymphatic system, usually the patients will report some long-term issues from that because it can cause long-term permanent nerve damage. That's when patients start getting into that post-treatment Lyme disease syndrome. These patients usually have long-term chronic joint pain, cognitive difficulties, things like that. Unfortunately, the prognosis long-term, once it has gotten to that stage, usually is not the best because the nerve damage has been permanent at that stage. So, if you get bit by a tick, look out for the bite. Now, know that this isn't prevalent in all areas. Where I live here in Oregon, there is quite a few, actually quite a number of Lyme disease cases. I live in an area where ticks are prevalent, when outdoor recreation is quite prevalent as well. So one of the best things to do with patients, especially in an area like mine, is make sure that you teach them good outdoor habits and hygiene, things that they can do to protect themselves from ticks, appropriate bug spray, appropriate clothing, making sure that they know that if you go on a long hike, you should have somebody look in all your folds and bends and make sure that there's not a tick on you afterwards, things like that. Checking your animals, especially, if you're taking your animals with you on hikes, making sure that you're looking. Common places usually are in the armpits, in the groins, on the back of the neck. In children, make sure that you're looking under clothing straps and things like that, anywhere that a tick may be bitten. When it comes to diagnostic testing for Lyme disease, usually it's based on symptomology and tick exposure. Usually a patient will come in with the characteristic bullseye rash or the erythema migrans, and they may or may not report that they've had a recent tick bite. We may perform antibody testing using either the Western blot or the ELISA spectrum. Usually they're testing for IgM and IgG. Also, there has some new research and some new evidence coming out about PCR testing, polymerase chain reaction testing for Lyme disease, because it does have such a long-term chronicity. There's a lot of ongoing research on management and further diagnostic testing and things like that. Other diagnostic testing may be based on symptoms. If a patient is having cardiac or nervous systems dysfunction, we may order things like a lumbar puncture to test cerebral spinal fluid. You may order an EKG, nerve conduction testing, things like that based on symptomology in the patient. Now, in terms of differential diagnosis, because it affects multi-body systems, and it can present in a number of stages depending on where we're at in the acute infection stage or how long you are out from the acute infection. Other differential diagnoses are based on symptomology. So if a patient is presenting with a facial palsy, you may need to rule out Bell's palsy, or things like shingles or meningitis, radiculopathy, other nervous system issues. You may need to rule out sciatica or other joint issues. Often the erythema migrans rash might be confused for a cellulitis infection or a spider bite or something to that effect. There may also need to rule out other autoimmune diseases. It is important to note that Borrelia genus bacteria are not the only bacteria that are spread through tick bites. So if a patient is not having the best response to treatment, or maybe not the response that you're expecting, you may need to rule out other bacterial infections and illnesses that are common in tick bites. Common ones include babesiosis and ehrlichiosis from the Babesia genus and the Ehrlichia genus, also bacteria that are spread through tick bites. Again, long-term prognosis is good, but it's based on catching it early and treating it early. Otherwise, we really kick into that long-term, how do we manage this chronic condition? So yeah, make sure that if you're going outside and hiking, you're watching yourself for ticks, you're watching your loved ones for ticks, anything that's looking weird on your skin, you're having checked right away. Otherwise, go out there and have some fun. Thanks. Bye-bye.